Senator from Washington.
Thank you, Mr. President. Mr. President, I come to the floor of the Senate tonight with my colleagues to share the stories of families in our home states whose lives are now healthier or have even been saved because of the Affordable Care Act, including those who depend on Medicare and Medicaid, people whose voices now more than ever need to be heard here in Washington, D.C. But first, I'm going to make clear how the Republican plan to repeal the Affordable Care Act will rip apart our healthcare system. And after what came to light late last week, I also come to the Senate floor tonight to stand with the millions of women, men, and families nationwide who are rightly outraged that this reckless and harmful effort also includes a plan to defund Planned Parenthood. Mr. President, for 7 years now, congressional Republicans have made all kinds of empty promises about how undermining families' health care isn't going to hurt anyone. That if the Republican-controlled Congress privatizes Medicare, cuts Medicaid, defunds the nation's largest provider of women's health care, and guts public health and prevention programs, somehow families are going to be magically better off. Well, Mr. President, let me be clear. Ripping apart our healthcare system with no plan to replace it will create chaos. This is a view shared not just by Senate Democrats who are here tonight, but by independent experts. And in fact, it's a view shared increasingly by state Republican leaders across the country, including some senators and congressmen. On last Friday, just to cite one example, the Republican governor of Arizona urged his party in Congress not to rush to repeal the Affordable Care Act, saying, and I quote, "I don't want to see any Arizonian have the rug pulled out from underneath them in terms of changing this law." Mr. President, if Republicans repeal the Affordable Care Act, it is women and kids and seniors and patients with serious illness and people with disabilities who will bear the burden. Premiums will skyrocket. Out-of-pocket prescription drug costs will rise, and overall healthcare costs will increase. It is a perfect storm to make America sick again, and absolutely the wrong direction for our families and our economy. Mr. President, I have to say, I have never seen a start like this to a Congress where the majority is jamming legislation through on a fast-track basis with no hearings for public debate or actual legislative text. And I have to say, as a former chairman of the Budget Committee, I have never seen such an abuse of the budget process. What many of my Republican colleagues are doing right now is unprecedented, but it gets worse. As if all of their harmful plans weren't enough, House Republicans announced last week, after meeting with Vice President-elect Pence, that they plan to defund Planned Parenthood in this budget. In other words, congressional Republicans are not only trying to undo a law that protects women from being charged more for men for their health care and ensures birth control is covered without a copay, they're also going after the nation's largest provider of women's health care as well. They are doubling down on their shameful and tired obsession with undermining women's access to health care, and it will have devastating consequences for women's health and rights and economic security. So, Mr. President, I am here with a very clear message, not on my watch. I, along with my colleagues and women and men across the country, have fought this fight before. In 2011, in 2013, in 2016, and we will fight it in 2017. We know what Planned Parenthood means to the millions of patients, men and women, who have trusted it for over 100 years for cancer and STD screenings, for HIV tests, for birth control, so much more. And we are not going to let extreme politics get in the way of their health care. So, Mr. President, if Republicans think causing chaos in our healthcare system, heightening economic uncertainty, attacking women's health and rights, and burdening our seniors and their families with higher health care costs somehow makes our country, quote, greater, well, they're obviously not listening to millions of families who did not vote in November for higher premiums or a health care system thrown into chaos. I have to say, in fact, in my home state of Washington, Mr. President, I have heard from moms and dads and grandparents who are finally experiencing some stability and are able to cover their families with quality, affordable health insurance, many for the very first time. There was a mom from Bellingham, Washington. She sent me a story about how the Affordable Care Act helped save her son's life when doctors found a life-threatening blood clot during a routine physical. She was not only able to afford the preventive checkup that found this clot because of her new coverage, but her son's treatment was then covered by the Affordable Care Act through the Medicaid expansion. I heard from a small business owner, Mr. President, from Spokane in Washington, who told my office about his wife, a retired nurse of 62, and how she was able to get a better plan thanks to the Affordable Care Act. He told us what this meant for his wife and his family. You bet he gets upset when he hears Republicans say the law hasn't worked for anyone or that they want to privatize Medicare by turning it into a voucher program. And finally, Mr. President, I want to share the story of Kalen. He's a software engineer from Seattle and his son Bryce. Kalen reached out to my office right after the November election. You see, 2 years ago, his son Bryce was kayaking in West Virginia, and he injured his back. But the pain in Bryce's back didn't go away for months. What doctors first suspected as a stubborn muscle strain ended up to be a rare type of bone cancer called Ewing sarcoma. Horrible news. Thankfully, his family had health insurance. Today, Bryce is getting excellent treatment at Seattle Children's Hospital, where doctors have been able to ease some of his pain, and he's responding now to chemotherapy. But Mr. President, Bryce, who's now almost 18, will need care, expensive care, for many years to come. And Bryce's dad, Kalen, is gravely concerned that if the Affordable Care Act goes away, the pre-existing condition protection that we fought so hard for in this law will go away, and his son will not be able to afford health care or get the benefits and treatments he is going to need in the future. Now, those are just 3 stories, but they represent many of the more than 600,000 people in my state who are part of the 30 million Americans across the country who are benefiting from this law today. Of course there's more we need to do. I've said it before. The work didn't end when the Affordable Care Act was passed, far from it. Democrats are ready. We have said it before. We've always been ready to work together to make health care more affordable and more accessible and better for our families. Mr. President, I hope Republicans reverse course right now and agree to work with us on improvements to the health care system. That's the path to take if they're truly serious about helping families. If they don't, and if they continue rushing to take away families' health care with no alternative plan, they will be fully responsible, and they certainly will be held accountable. The real impact will be on millions of families across our country, families like the ones I just talked about, and those you're going to hear about throughout tonight. Democrats, Republicans, and independents who do not want to see this law repealed, and they want us to work together to improve it instead. I hope Republicans are listening. I urge them to make the right choice. Thank you, Mr. President, and now I'd like to yield the floor.